Welcome back. It's still Rise and Shine, and of course today is World Tuberculosis Day, and we had promised to bring you an expert who's going to talk to us about tuberculosis and issues surrounding tuberculosis in Nigeria, and of course guide us through what we need to do as individuals to help ourselves, to help our family, friends, and loved ones who might be at one point in time in need of help when it comes to the issue at heart. At this point, I'll let Otobasi do the introduction of our guest.
We've been joined by a doctor in the studio. He is a medical microbiologist with the University of Uyo Teaching Hospital. I'm talking about Dr. Ekuma Agam. Your father Agantem. Yes, exactly. Okay, let's quickly get down to it. What is the new development in tuberculosis that we are yet to be aware of?
Well, we seem to be losing some of the gains we have made so far in TB control and experiencing for the first time in 10 years increasing mortality. And I believe this is due to diverted attention towards COVID-19. So I think that's what is new in TB.
Well,
So, you've mentioned the different new things that is happening in the world of tuberculosis. Now, my question is, tuberculosis, are there variations of tuberculosis? Are there different kinds of tuberculosis?
Well, yeah, the differences which are important, of course, for every organism, they are just like human beings look different and so also there is variation among microorganisms as well. So, but what is important for in terms of control of tuberculosis is their susceptibility to the different treatments that are available for tuberculosis. So the major different type of TB we're talking about are the drug-resistant
Level?
phenotypes. Let me use that word. So we have drug-resistant tuberculosis, we have multi-drug resistant tuberculosis, and now we have extensively drug-resistant tuberculosis. So all those different types of tuberculosis need different levels of treatment.
all right, I'm concerned about this. What would you say are the major triggers, the major causes of tuberculosis?
Well, like I heard from the trailer before I came up, or maybe I'll call that a lecture.
It's a report, actually.
So yes, it's an infectious disease, so it's spread from one person to another. And okay, like it was also mentioned, we have the latent TB and the active TB. So what leads to anyone who is exposed to the bacteria will develop latent TB if his immune system is active and competent. However, due to changes in the immune system, which not all of them are fully understood, but some of them coming from other conditions like you've mentioned, HIV and malnutrition, diabetes, and so on, could lead to trigger the full-blown active tuberculosis. And then also there are some people whom you cannot find any particular risk factor, but they still come down with tuberculosis, and it's believed to be due to different the way their immune system reacts to this bacteria.
So, our immune system contributes significantly to how we are exposed or susceptible to contacting tuberculosis.
Let me say how we respond to the
Infections.
Yes.
Okay.
Well, let me quickly get to know about clear the air with the myth and what's not true about tuberculosis. Is it true? Is it incurable?
No. So it's not true. It's not true that it's incurable. So, but it requires prolonged treatment due to some, like we are trying to every living thing tries to find a way to survive. So this bacteria has developed some mechanisms to survive, and for us to be able to effectively treat it, it needs prolonged treatment over several months. So it's not incurable, but it needs prolonged treatment. Yes.
So, what are the major factors to getting a cure for it? Apart from medications, okay, or is it constant medication, or what's the real key to achieving a cure for TB?
Yes, so like I said, prolonged medication and being regular on that medication.
Regular.
So you notice that for many people, when they start treatment, as soon as the initial symptoms disappear, they become very irregular with their treatment. And I think that is one thing that drives the resistance. So if an organism, a microorganism, is, exposed to suboptimal doses of treatment, rather than being killed by the treatment, it rather develops resistance to the treatment. So I would say for anyone on treatment, you have to take that treatment religiously for the duration that is taken, even after the symptoms disappear.
Well, I'm concerned. You said prolonged treatment.
Treatment.
Prolonged treatment. How
Yes.
long?
So
is
we're
any
talking
time?
of
Is there any time frame?
6 months to 9 months, and I think there are some regimens that are up to 12 months.
Whoa.
Wow. Okay, that is a serious issue. But
Yeah,
I'm
it
not.
is
I'm
a
not.
serious
I'm
issue.
not. I'm not going to focus on the seriousness of the prolonged treatment, because I want to believe that anybody who is ill and is given the treatment and wants to get well would, to some extent, commit to taking the drugs. But now, my question is, how prevalent is tuberculosis? Let's start with our immediate environment, Akwa Ibom, and then Nigeria. How prevalent is it?
Well, it's quite prevalent. So again, talking about the latent tuberculosis, so I think quite a significant population. Maybe we're looking at almost half of the population, or more than half, have been exposed to tuberculosis. So they have a latent form of the tuberculosis, which ordinarily will not cause any problem. That means your immune system is totally in control. So, but for those coming down with active cases, the prevalence is much lower. We're talking of maybe below 10% of the population.
Well, there's still more to talk about on this particular subject, but rather than now, we'll put a pause to it and go on a short time up. Maybe take the report again. When we return, more details on tuberculosis. Don't go away. Well, it's glad to have you back, and this is your Rise and Shine meeting live from the beautiful hills of Ibiakuren, and this conversation is live on our different social media handles on Facebook with the handle SpectrumTv to NG. So let's get talking, and if you have concerns or comments, we would want to hear from you. Meanwhile, we still have Doctor in the house who is shedding more light on issues as relating to tuberculosis. And yes, today is World Tuberculosis Day, so it's another way to campaign for, or maybe as a way to end tuberculosis. I'd like to quickly ask you this. One of the symptoms of TB is cough. So, is every cough tuberculosis? No, I like to clear that.
Of course not. So we have seen different.
So, at what point would you say a cough is suspected to be tuberculosis?
Okay, so the classic definition of tuberculosis cough is cough that persists for 4 weeks.
4 weeks.
Yes. So if someone keeps having cough persistently for 4 weeks, then you have to suspect tuberculosis. So cough that persists for 4 weeks. So usually other forms of cough, viral causes, common cold and all that, will resolve in 1 week or at most 2 weeks. But if it persists up to four weeks, then you need to seriously suspect tuberculosis. Then again, as it gets more serious, the cough becomes productive. That means something comes out when you cough, and then as it progresses again, you begin to see blood stains in the cough. So those are classic signs of tuberculosis. And then if within that 4 weeks you begin to notice some loss of weight too. So yes, that is how TB. Then you begin to strongly suspect TB, and you need to be tested at that point.
Well, okay. Yeah. Other point. Are there nutritions that one can take to ensure that maybe it could, leverage on reduce the chances of contacting TB?
Well, I wouldn't want to say that the nutrition itself will fend it off. But what I'll say is that since malnutrition is one of the risks, malnutrition can lead to a reduced immunity, which can predispose one to developing tuberculosis, active tuberculosis. Then that implies that proper nutrition will also boost your immunity and protect you from tuberculosis. So I'll say having a healthy diet is very important for your immune system, and your immune system will now keep any tuberculosis that you may have been exposed to, keep it in check.
Okay, so the lectures is just getting more interesting. We've got to discover now that you cannot just write off every cough as being tuberculosis or tuberculosis related. But then, given the fact that we're talking about tuberculosis today and it's World Tuberculosis Day, and there is need for us to not just talk about the cause and all of that, my next question is, presently in Akwa Ibom, in Nigeria, how much is being done about this tuberculosis disease?
Well, the government is making efforts in that direction, and the effort of the government is being supported by a number of non-governmental organizations who are providing funding, technical capacity, equipment. So, like I think it has been highlighted in the theme of this year, that is about committing more resources to tuberculosis. So yes, a lot is being done. I know that within the states, the diagnostic capacity, which is like my major area, is quite increased. We have I can't quote the exact number of machines that we have for diagnosis, but I know that in most of the major hospitals, we have this machine. It was shown in your reports, although I know many people will not know what it is, but they call it a gene expert machine. You know, formerly the way to diagnose TB used to be by taking the sputum from the patient, putting it on a slide, staining it, and then looking at it under a microscope. But then you need very well-trained persons that can easily spot it. So the World TB program has come up with a new, more advanced machine that actually checks the sputum for any fragments of the bacteria. So that has boosted our diagnostic capacity, and that is now making more people whom we couldn't be sure whether they had. So those people are now being clearly diagnosed as positive or negative. Because treating a negative person too is a waste of resources, so that diagnostic capacity has I think it's a game changer in the control effort. So I think in terms of the commitment, the government and NGO partnership, the government has kept his own part, providing making the health centers accessible, providing manpower. Then the NGO partners are providing technical capacity and equipment.
Now I know that the drugs are free.
Yeah.
How about the diagnosis? Is it free?
So diagnosis is free too. Yes, every diagnosis.
At what point would you have to go to the special hospital at a clinic to get diagnosis, or is it available at everywhere?
In most government hospitals, it's available. And there's even a network where even when it is not available on sites, they have a system where those samples can be sent to the nearest place where the test can be done. So if, for example, in a particular center, let's say in my hospital, the machine is down for one thing or the other, so there's a system that those samples can be sent to the nearest one that is still in service,
Okay.
and the result can be available promptly. So the point there is to make the result available on time.
Well, I'm concerned with the ratio of infection. So since you're majorly on the diagnosis, maybe you are in a better place to tell us the ratio of infection. Out of 10, how many persons have TB in appointment?
Well, the first thing is, out of those 10, are they 10 healthy people on the street or 10 people coughing? So the people who come for tests maybe already have one symptom or the other. So in that population, of course, the ratio will be higher. But if you're talking of the general population, I think it's still, for all intent and purpose, it's still quite low. It's still quite low. But like we say, it is rising. And so out of 10, maybe I think we'll have to talk about 100.
Okay, out of 100,
So
what's the ratio? What's the percentage?
Well, I don't have the current data, but
Roughly,
if I would take an educated guess, I'll say it's about 3
3
or less.
3 or
3 out
less.
of 100.
That's active tuberculosis.
Okay.
So when you talk of latent tuberculosis, that means the person has been exposed to it sometime in their lifetime. Then it's much higher, and I think that's where we even need to be looking at now.
Okay. So you've mentioned one of the things we actually talked about before you come on said was the fact that, considering the fact that tuberculosis is an infectious disease and there has been recent calls for more investment to be done. Now, you've said that in every or in major government hospitals in the 5 state, for instance, we have diagnosis centers, and of course, after the testing, the treatments are being done. Now, I don't know, as a doctor, an expert in the field, I want to ask, are you aware of any plans by government to ensure that, okay, we have these diagnosis centers across the entire state at every government primary healthcare center?
Well, I'm a microbiologist, and those decisions are taken at the public health level. So you have to look at the costs versus the benefits. So how many of these tests come into a particular health center? So I think it may be more economically sound and more because we have to manage our resources so that we don't push all our resources to one disease and other diseases begin to suffer, just like this COVID has. I think COVID, since it came as a pandemic, a lot of resources were pushed in there, and that left TB to suffer a bit. So we have to make sure we don't fall into that trap. So I would say, in my own opinion, the current capacity in the state is, to me, it's quite adequate. So what we need to do is to bring out, get our community leaders, to ensure that there is a lot of awareness, and everybody that is at risk or has any symptoms that is suggestive, being that the government has made this diagnosis free, so everybody should have access to a test. Whether it's going to come out positive or negative, they should be tested. So that one out of that, those 2 or 3 out of 100 will be picked up. So I think what needs to be done for me, in my own view, sitting where from my own vantage point, is that there should be more awareness in the community, that everyone coughing for a prolonged period needs to carry out this test, and so that it can be picked up early, and the chances of effective treatment will be higher.
Yeah, we're rounding up with this now. What would be your last words? World Tuberculosis Day. Now, the team is investment. You've said that what we have already in the state
is sufficient.
In terms of diagnosis now.
Yeah. But then again, at what would be your last words on that?
Well, as the public, including the government, the healthcare providers, and the population, we need to remain vigilant. So like we've said, these organisms keep resurging. They are also fighting for their own survival. So we need to remain vigilant in terms of keeping the awareness up. And even though tuberculosis is said to be a disease of the poor, but the rich also get affected. Like a story I heard some years ago about a very big corporate individual who presented in the clinic, and you know, even though the doctors didn't want to test TB, eventually they tested TB and found it positive, and they were like, "Where could you have gotten this from?" And he realized that his driver had been coughing, both of them inside the air-conditioned vehicle. So if we don't find a way to ensure that it is totally eradicated from our society, every one of us is at risk. And like we have seen, these organisms, they have capacity to come back stronger if they are not fully taken care of or dealt with. Thank you.
Well, thank you very much, Doctor, for being on the show. It was nice having you share your thoughts with us. Yes, we were talking with Dr. Agantem. Exactly.
Yes,
I have to take my time with that. And now he's a brother from a brother from a sister state, right?
Yes, yes.
Agantem.
And your TV station covers the Aqua Cross region.
Yeah, so it's a family TV.
Absolutely. Now that's staying informed.
Yes.
Okay, thank you very much for joining us on the
My
show.
pleasure.
Maybe we look forward to another conversation of this kind.
Follow Spectrum TV everywhere you go on your Android and your iOS devices. Join our social media community. Like us, follow us, share, comment on our post, and let's get interactive. And do well to visit our website at www.spectrumtv.ng. Now you have no excuse not to be connected to the first privately owned television station in the Aqua Cross region. Spectrum Television. Broadening your horizon.